Hi, my name is Cindy Powell, and I've had the pleasure of being a sports and orthopedic physical therapist for many years. And I'm really excited to share with you, for anyone who's not aware, of body weight support treadmill training. This is becoming very popular, especially in therapy and rehabilitation. Body weight support treadmill training did not come into existence until the 1990s, so not everybody is familiar with it yet, and it wasn't extensively researched until the late 90s. Now there's a huge body of evidence supporting this type of training for therapy and rehabilitation, as well as sports performance enhancement, and it has proven so valuable that every major college and pro sports team, every elite athletic performance center, top physical therapy clinics, athletic training centers, and gyms are spending millions of dollars to get this type of equipment. In the past, the only available equipment was the harness body and weighted treadmill training systems, and they all have wonderful applications, but they're very limited. The harness systems, because of the difficulty of use, the time it takes, how cumbersome they are, and how uncomfortable they are, they have very limited body and weighting capabilities. Even by the time you reach 20% body and weighting, they become very, very uncomfortable. So they're very appropriate for early and acute rehabilitation, but after that they become less useful. Anti-gravity air chamber systems came along, and they are very expensive. They're a little bit difficult in the sense that they're hard to get in and out of. You cannot access the client while they're on these systems, and again, they have limited unweighting capabilities. There are still people who get into these systems, and as they run, there's not enough unweighting to actually allow them to exercise comfortably, and for the amount of money they cost, that's a significant limitation. Then there is the pelvic suspension system, which is designed by Glide Cycle, and it's the first of its kind for indoor and outdoor body unweighting. The pelvic suspension system has a few advantages. The biggest advantages is the tremendously low cost. This is accessible to patients and just about every physical therapy clinic that wants it. Second of all, it's very simple to operate and use and get patients in and out of. Patients are very stable in the system. You can access patients, and you have the simple fact that gravity is working on all the limbs in the same way it would be if you were walking or running. Therefore, you get a tremendous aerobic workout. So we can challenge even the highest level athletes and most fit individuals on this and help them regain and maintain their fitness while they're recovering from injuries. And that's a huge, huge bonus. You don't have the buoyancy and resistance of the pool slowing down your limbs. You don't have to take time out to find a pool, and the aerobic capabilities are tremendous. There are many other advantages, but to keep it simple, those are the big ones. Patients with neurological conditions have experienced really successful and exciting outcomes, and sometimes unexpected, but what I'm really excited about is to present to you the most obvious application for the GlideTrack and Glide Cycle equipment. That is orthopedic and sports physical therapy applications. So the GlideTrack body weight support treadmill training system is the most pain-free walking and running aerobic experience possible, simply put. That's very important. Also, it allows 0 to as much weight bearing as you want, but if you get a prescription from a doctor saying they only want partial weight bearing, that's very easy to achieve on the GlideTrack. Just by simply setting someone up, you are achieving much less than partial weight bearing on a typical setting. We can reduce someone clear down to 0 weight bearing. We can have them favor one limb and continue to exercise on this, so that's very important to note there. We have a full range of weight bearing on the GlideTrack, and that's its most important feature. So we can take someone and let them exercise completely pain-free and comfortably. If a physician sends a prescription for weight bearing is tolerated, no problem. We just dial in a comfortable amount of weight bearing that we want. So anything that we need to honor as far as doctor's orders, we can do on the GlideTrack. Also, there are many conditions that respond wonderfully to this. We already know. This is ideal. The GlideTrack body weight support treadmill training system is really, really helpful for people preoperatively and postoperatively, no matter how simple or extensive the surgery. Preoperatively, obviously you want to get in the best shape possible so that you have the fastest recovery possible, and that's what this does. Some patients have even found that the GlideTrack significantly reduces their pain before they have surgery. They actually can exercise pain-free again, walk pain-free again. Some people may even be able to postpone surgeries or cancel surgeries for the time being just by having this type of training that was never available to them before. That is entirely possible. This helps to reinforce full hip range of motion, which is really important if you can imagine after hip surgery, total hip replacement surgery, or hip fractures that are very, very common. This also stabilizes patients very nicely with the shoulder harness system so that patients are safe in there, so even the geriatric patients with hip pinnings and hip fractures can do well in this. It also helps regain terminal knee extension and quadricep muscle control, especially if you set the treadmill into a reverse treadmill mode, and it can allow significant quad strengthening with the retro walking. And it's very important for people after many different types of knee surgery. So knee patients, hip patients do wonderful on this. Now it can also help people with foot and ankle problems that are very sensitive, or toe problems. It's also very helpful for people with various SI joint and back conditions. As a matter of fact, there is a position of comfort for almost every patient with a back condition that gets onto the GlideTrack. You can simulate a neutral upright spine with a slight anterior pelvic tilt to maintain the natural curve of the lumbar spine, and that's wonderful for people with disc injuries, chronic back pain, sciatica. You can also help slightly round the back for those who have lumbar stenosis and who need the pressure off those painful joints so that they can move and exercise pain-free. So there will be very few patients with back conditions that can't find a comfortable exercise position. Some people get in the seat and are immediately comfortable and notice a reduction in their back pain. Some people get in the seat and notice a little bit of discomfort, and then as they exercise it goes away and remains gone after they get out. So that's important. We like that there's functional carryover and reduction of pain when people are done on the GlideTrack. There are also some other applications that are really important. Overweight individuals find this to be tremendously helpful. For instance, if a person weighs 100 pounds on a GlideTrack, they will weigh 30 pounds or less with an average setup. If a patient weighs 200 pounds, that drops their body weight to 60 pounds or less when they're exercising on the GlideTrack. Just stop for a minute and think how that would feel to someone who's overweight with painful joints who wants to exercise again. It's empowering, it's effective, it's comfortable, and it's dignified. And we can put people on there all the way up to 350 pounds and some larger folks onto this equipment. The other applications include things such as cardiac rehab. What a great cardiac rehabilitation tool where you can really monitor your exercise output. If a person needs easy exercise, they can get it. If they need challenging exercise, they can get it on this equipment. Also, a really important application is sports performance enhancement training. We can take athletes and push them and work them all the way through most injuries on here. They can favor a joint, they can experience pain-free exercise and recover faster and not lose the fitness, not lose that ground that so many lose anytime that they're injured. That's tough to maintain, but it's fun and it's easy on the GlideTrack and the outdoor glide cycle. We can take these athletes and we can train them for more days. We can produce higher level, higher intensity workouts without the risk of increased pain or irritating an injury. We can use it for recovery training, overspeed training, stride lengthening. There are so many applications. People can train 7 days a week on it, although we always recommend days of rest, adequate rest, and cross-training when possible. So those are just some of the wonderful benefits. Orthopedics is the way to go with body weight support treadmill training. And as it picks up momentum, now you will be aware that this equipment is there and it's totally affordable. Body weight support treadmill training is here to stay. It's the newest wave. Be sure to get your patients on it and be sure to try it yourself. Thank you for your interest and for your time.